Good day, class. You are welcome to study section 10 of this course, which is Diet Therapy. Introduction. A healthy diet is fundamental to sustaining life, supporting vital disease is caused by a gluten intolerance that interferes with absorption of nutrients from food. Gluten is a protein in wheat, rye, and barley. Acne vulgaris, or simply acne, is a diet-related disease, especially common among American teenagers. Acne can be distressing, annoying, and persistent. Acne lesions heal slowly and are often replaced by new blemishes. Irritable bowel syndrome is a diet-related disease that causes significant abdominal discomfort. Irritable bowel syndrome occurs when smooth muscle in the large intestine contracts slower or faster than normal, and that the condition affects almost twice as many women as men. Common signs and symptoms associated with celiac disease include diarrhea that comes and goes, abdominal pain, abdominal bloating, irritability, depression, upset, stomach pain, and mouth sores. Classification of nutritional deficiency. Nutritional deficiency can be classified into the following: absolute deficiencies, relative deficiencies, which is equals to nutritional deficiency. Absolute deficiency are caused by chronic inadequate consumption of amino acids and nutrients that eventually result in depletion of reserves. Depleted nutrient reserves leave cells vulnerable to daily fluctuations in nutrient intake or to sudden increases in demand that occurs when unintended exposure to environmental stressors such as pathogens, chemical irritants, and oxygen free radicals, or to cellular injury from infection or trauma. Relative deficiencies can occur even if nutrients are consumed in adequate amounts to meet basic physiological requirements and maintain reserves, when these intakes are not sufficient to satisfy increases in metabolic demand. If subclinical deficiency is not corrected, then prolonged marginalization of cellular activity may only increase vulnerability of disease, but also exacerbate progression of existing disease and interfere with effectiveness of treatment, since all drugs require some level of metabolic support to achieve their desired therapeutic effect. Nutrient imbalances. Nutrient imbalances may be linked to initiation or exacerbation of virtually all diseases. These imbalances can be caused by either deficiencies or excesses of one or more nutrients. Nutrient imbalances impose a metabolic burden on all organ systems, with the greatest burden on those systems responsible for achieving and maintaining metabolic equilibrium. Excesses can be sometimes contribute to relative deficiency, by increasing demand of supporting nutrients to accommodate the increased rates of metabolism required for disposal of the nutrient surplus. Nutrient deficiency may often involve inadequate intake of vitamins, minerals, and omega-3 fatty acids, and ingestion of low-quality protein. Compensatory responses to nutrient imbalances. The primary objective of compensatory responses to nutrient imbalances is to establish physiological homeostasis. We have the glucose, fat, and homeostatic adjustments. The glucose. When large amounts of high glycemic index foods are repeatedly consumed throughout the day, the postprandial insulin response is sustained for a long period, which will eventually promote the down-regulation of insulin receptor that contributes to glucose intolerance. The fat. Elevated postprandial triglyceride level requires secretion of large amounts of glyconeurons to transport the triglyceride load from the intestine to the liver, where it is deposited, leaving behind a high concentration of chylomicron remnants. These particles are highly heterogenic with effects on arterial plaque formation similar to those of low-density lipoprotein. Homeostatic adjustments. If the amount of sodium ingested exceeds renal capacity for elimination, plasma volume will expand until the excess amounts are excreted and sodium homeostasis is re-established. Medical food. Let food be the medicine and let medicine be the food. Medical food is a unique category of regulated products that meet the distinctive nutritional requirements or metabolic deficiency of a particular disease state. Medical foods supply the body with the necessary amino acids to make specific neurotransmitters. Medical foods such as theramine, which is specifically formulated to manage the pain and inflammation of specific disease states, go beyond simple dietary interventions and are specifically formulated to meet the distinctive nutritional requirements of a specific disease that cannot be met with a simple dietary shift. The nutritional requirements of an individual in a disease state can be considerably different from those of a healthy individual. Recognizing and managing these increased nutritional requirements should be an integral part of the medical management of clinical conditions. This may be accomplished through the use of regulated therapeutic product class known as medical foods. Physiological effects of nutrients. Nutrients are required to drive the basic physiological activity that sustain life. All innate cellular functions, defenses, and repair systems require a continuous supply of nutrients provided by nutrient reserves to make up the shortfall as dietary intake fluctuates due to disease and other external causes. Additional defensive role supported by nutrients involves protein synthesis, reversal and repair of DNA and chromosomal damage, integrity of immune cell structure and function, and a whole host of other activities at the molecular level. Amino acids and disease. Amino acids are required to drive the basic physiological activities that sustain life. All innate cellular function, defenses, and repair systems require a continuous supply of amino acids and nutrients provided by cellular reserves to make up the shortfall as dietary intake fluctuates due to disease and other external causes. Additional defensive roles supported by amino acids and nutrients involve protein synthesis, reversal and repair DNA and chromosomal damage, integrity of immune cell structure and function, and a whole host of other activities at the molecular level. If amino acid and nutrient intakes are not sufficient to adequately support these basic physiological activities, adaptive mechanisms are triggered to conserve the available supply. Among these mechanisms are increased efficiency of intestinal absorption, enhanced renal reabsorption, adjustment of metabolic rate, and a compensatory shifts to ancillary pathways that minimize demand. Thanks for listening.